So I practice stem cell medicine for the treatment of chronic musculoskeletal pain.
You guys have kind of been the, shall we say, the proprietors of the full body.
Stem cell therapy is using the body's own natural healing response. We get people very comfortably to sleep. We take a large volume of stem cells, supplement with a large volume of exosomes, inject the entire spine from the base of the skull down to the tailbone, flip them over, both shoulders, both elbows. Amy Killen, who injected y'all's faces. And
she's the reason I look like this.
Yeah. She does this. She does that. She does the skin of the face. She does the scalp to improve the health of the hair follicles, and she does the sexual organs for sexual optimization. And that really launches a massive healing cascade.
All right, Life to the Max podcast. We are here with the incredible Dr. Adelson. This is going to be a little bit of a different podcast for our listeners, who are kind of used to us really talking about health and wellness from a completely different perspective. So for those who do not know you, give us the history.
Sure.
Who are you?
Sure. So I practice stem cell medicine for the treatment of chronic musculoskeletal pain. And with people who have chronic musculoskeletal pain, there's certain things that people can do on their own to help with their own wellness and pain level, but at a certain point, they need help. They need an intervention. And in my case, it's for people who are interested in a naturopathic intervention. Stem cell therapy is using the body's own natural healing response. From my own experience, when I was in my first year of naturopathic school, I was crazy into rock climbing. My whole life revolved around rock climbing. And I was training hard. I was getting ready for a trip to France, which is the birthplace of modern sport climbing. So I was training really hard in the gym, and I did this hard cross-through move, and I felt this pop in my shoulder.
Uh-oh.
And that threatened to cancel my trip. And I saw a surgeon, and he said, well, I can put a scope in there and cut that piece of cartilage out, and it'll probably, this was like 4 months before the trip, he said, it'll probably help you in the short term, but it's going to cause you problems later in life. Well, it just didn't make sense to me. I mean, I just wasn't willing to take no for an answer. He said, alternately, the other thing we can do is do a steroid injection, which will take the pain away for a period of time, but it's not really going to do anything to help the problem. And it just didn't make sense. I mean, here I was in naturopathic school learning about the body's ability to heal itself. The guiding principle of naturopathic medicine is vis medicatrix naturae, the healing power of nature. I was introduced to the guy who was then to become my mentor and dear friend, Rick Marinelli. He did regenerative injection therapy, also called prolotherapy, which is the injection of natural substances into damaged tissue, effectively tricking the body into thinking that there's been a new injury, thereby launching the body's natural healing cascade. And it worked so well on me that my life path unfolded before me.
And when was this?
That was back in the early 90s. I mean, that was when I was in naturopathic school in 1995, I think. So,
so that's how you got your inspiration to what you're doing now.
Right.
That's amazing.
So
I feel like that's always the case where it's like, the case where it's like you have your own injury, your own illness, your own something, and that's usually what provokes you to, make some life changes, even change a career, right?
That's exactly right.
It's amazing.
So I out of school, I practiced full-time prolotherapy, the injection of natural substances, and I did that for overall about 6 years. And then platelet-rich plasma came along. Platelet-rich plasma is the use of, you do a blood draw, concentrate down the platelets from your own blood and inject that, and platelets are what release signals to trigger your own stem cells to activate. Did that for 4 years, and it worked much better than prolotherapy. And then in 2010, I had a patient come to me and say, I want you to take stem cells from my bone marrow and inject it into my knee, because I'd helped her to a certain point, but didn't completely help her. And I learned how to do bone marrow, how to aspirate and prepare bone marrow stem cells, and that was in 2010. And so very fortunately, I was one of the first really 10 people in the United States doing stem cells for the treatment of pain. And then that evolved to all the stuff that we're going to talk about now. But effectively, what we do here is we take people who have suboptimal healing. So they've had some form of either an acute injury that never completely healed, or repetitive stress. Maybe they we get a lot of farmers, for instance, who've just worked their bodies to the max, and they've torn their bodies down faster than their own stem cells can build them back up. And yeah.
Wow.
Awesome. So one of the things I want to let's take a step back and talk about how stem cells work, how PRP works, because I know that there's a really unique integration between those in the body. And how did you actually, make that leap from PRP to stem cells, and then now there's a next gen that you guys are kind of doing here. And just so everyone knows, there's a reason why we look like burn victims. I look like burn victims. You look a lot better. And we're going to talk a little bit about that too with the amazing Dr. Amy Killen coming up. But I think some of the stuff that we're going to talk about here is going to cover this. So there is a reason we look like this. Don't freak out. It's not your TV or computer monitor or cell phone or whatever that is. But yeah, let's. I'd love to get a little bit of a deep dive into how these things work, and then how interconnected PRP and stem cells are, and how. Basically, as we age, how that becomes a limiting factor in our healing ability.
Sure. So we have different cell types in our body. So we have heart cells that comprise our heart. We have liver cells that make up our liver. We have muscle cells. We have ligaments. We have all these different types of cells that perform different functions. And then we have other cells that circulate throughout our bodies, like red blood cells perform a specific function. They bring oxygen to the tissues. We have our white blood cells, which are largely responsible for our immune function. Well, we have another cell type called mesenchymal stem cells. And mesenchymal stem cells exist in most all of our tissues, but their function is to maintain the health of their microenvironment. When they're in a resting state, they're called pericytes. They wrap around blood vessels. And when you have vasoconstriction and vasodilatation, the blood vessels shrink or grow larger, that's a function of these pericytes. Well, when you have an injury and blood finds itself outside of blood vessels, the platelets, so blood, the major constituents of blood are the plasma, the red blood cells, the white blood cells, and the platelets. When platelets find themselves outside of a blood vessel, they recognize that there's a problem. They recognize they're no longer inside a blood vessel, and they release growth factors, the most important of which is called platelet-derived growth factor. When those pericytes come into contact with platelet-derived growth factor, they activate. They release off the blood vessel, and they turn into a mesenchymal stem cell. Mesenchymal stem cells are the primary way that our body heals after injury. These mesenchymal stem cells contain vesicles filled with growth factors, and these growth factors fight inflammation, they fight invading microbes, and they trigger the growth of the surrounding tissues because they recognize that there's been damage in that area.
So that's the inflammatory response, right?
That's part of it. They go hand in hand. So that whenever you have healing after injury, it is a stem cell mediated event. So when we used to do prolotherapy, injecting natural substances, that would launch that sort of inflammatory cascade. It would there's a little bit of micro damage from the needle, and then injecting these hypertonic solutions. And so what that would do is it would just sort of activate the platelets, which would then activate the stem cells. Well, PRP, platelet-rich plasma, is sort of skipping a step. We're just taking the platelets from normal peripheral blood and concentrating them, injecting that in a big dose, and that activates the stem cells that are in that area. Well, when you have somebody, and those therapies work very well for people who have mild to moderate conditions, whether it's arthritis or low back pain or neck pain. But when somebody's really sort of far gone, well, then they actually have a depletion of stem cells in that area. And so what we do is we take stem cells from the person's own bone marrow and, at this point, fat, isolate the stem cells from the fat, concentrate the stem cells from the bone marrow, and we'll also talk about some other items that we use, but then we inject that into the area of depletion where the person does not have a lot of stem cells to begin with, and that really launches a massive healing cascade.
So one of the things that I've heard, and this is, I love this, right? Because we love to talk about the science, but one of the things that I've heard is there a give and take as far as the trauma that's caused by the cultivation of the stem cells, either through the bone marrow or the fat, versus, what you're getting by injecting those into a damaged area? I've heard some people say that the offset the juice isn't worth the squeeze, but I'd love to get, the true scientist, the true doctor's point of view on that.
Well, the people who are saying that probably don't have low back pain.
Probably, yeah.
Because the people we get are people who are suffering. They have low back pain, they have neck pain, and they're suffering. And what we have to offer. So first of all, low back pain. Let's just take low back pain as an example. Low back pain is the leading cause of disability worldwide.
Really?
The economic impact of low back pain is greater than cancer and heart disease combined.
Wow.
Now,
okay.
It doesn't kill people, so it doesn't get sort of the research dollars,
right,
but it destroys people's quality of life.
Absolutely.
And economic function, ability to work.
Right. Yeah. And one of the measurements, one of the predictors of longevity is whether or not a person has a purpose in life. Well, if your purpose in life in any way involves the use of your body, then having low back pain runs the very real risk of robbing you of your ability to have a purpose in life. So it can really be a destroyer of quality of life.
And we were fortunate enough this morning to see kind of part of a procedure where you were focusing on lower back pain, right?
That's right. That's right. Yeah, the procedure we did this morning was a 70-year-old male with central stenosis. He has narrowing of the spinal canal, which is causing him quite a bit of back pain and leg pain. And this is a very typical kind of thing that we treat here.
And how quickly will he see results?
So that's a really good question. So when we take these stem cells and put them into the air, so first of all, let me just say what it works for and what it doesn't work for. So what I found stem cell therapy works really well for is pain conditions. It doesn't work as well for conditions where people lose function. And the reason for that, this sort of brings us to the whole idea of what is the pain generator. We get so sucked into, well, what does the MRI say? Now, MRI is a great tool, and you get a ton of information looking at an MRI, but a lot of times the information that you get is just distracting information. It doesn't actually give you useful information. The reason we know this is because if you take 100 people with no low back pain, people who've never had low back pain over the age of 45, and you do MRIs on them, 60% of them are going to have abnormalities on their MRI, even though they don't have any back pain.
Really?
Similarly, if you take people with lots of low back pain, a lot of times their MRI is perfectly normal. So that sort of calls into question, well, what's the pain generator? There's two types of pain generators. There's pain generators that are actually structural. Now, those people frequently have functional problems. There's actually, they're either having like radiating nerve pain or loss of function. Maybe they've got foot drop, or if it's in their neck, they're not able to use their hand. So that is a functional problem. Stem cell therapy does not work very well for that. Those are people who really have, they're really surgical candidates.
Okay.
However, if people just have pain, maybe the MRI isn't even telling us the right information. And when so what we think with people who have this sort of, these sort of pain syndromes where what you see on the MRI doesn't even necessarily give you the whole story, this is a problem that's on the microscopic level. This is people who have problems of either, issues of their collagen fibers, of their integrity of their sort of connective tissue on a microscopic level. So,
No.
I'm like, my brain's going faster than my mouth is. Yeah. Connective tissue is a miracle fabric, and it stretches just the right amount in every direction. And the nerve fibers that pass through it pass freely through it. But if you have damage to that tissue, it loses this miracle fabric loses its miracle properties. It stretches too much in some directions. And
now, is that fascia, or is that
correct.
Something different? Okay.
That's exactly right,
okay.
fascia. And more importantly, the nerve fibers that pass through it get caught up. So instead of this nice, free-flowing connective tissue fascial planes, they're stretching too much and the nerves are firing pain signals. The other thing that happens is something called neovascularization, where when you have suboptimal healing, you have a hyper concentration of microscopic blood vessels. Now, the problem with that is these are irregularly formed. So, and every time you grow a new blood vessel, you also grow a new nerve fiber along next to it. So now you have a hyper concentration of sensory nerve fibers. And because they're irregularly formed blood vessels, you actually lose the ability to bring oxygen to the area and metabolic waste away. And this is one of the things that we know stem cells does beautifully, is they help to restore the health of the microscopic tissue. And the reason that we know that this happens is because one of the areas that has the strongest body of scientific literature is wound care. If you have a non-healing ulcer, if you put stem cells in that area, what happens is first blood vessels, healthy blood vessels grow, and then skin grows over top, which is a form of a collagen matrix.
So that brings up so many questions. I want to go back to, looking at the MRI versus how do you diagnose that? And then as you're really looking to inject these into specific areas, if the MRI isn't giving you a clear indication of where to go, how do you make that decision? And this kind of came out of what the procedure we saw earlier, where you were marking, the specific areas where you were injecting the stem cells. So how is that diagnosis developed?
9 questions. I ask the same 9 questions, exactly the same questions in the same order, and I listen to the answer. And that's, there's 2 parts. One is asking the right question, and then the other is actually listening to the answer.
What was that?
Exactly. And that's one of the things that's one of the arts that's really been lost in medicine, is if I ask people these same questions and I really listen to the answer, people always tell me what's wrong with them. Now, there are certain answers that will disqualify them, like if they have foot drop, like if they lose use of their hands. I mean, and those are things that I actually. So what we do here is we have some very simple paperwork that we have people fill out. I look over the paperwork, and just based on that, I have a pretty clear idea whether the problem is structural or microscopic. And if it is structural, I refer people to the surgeon. I mean, if I don't feel like I'm going to help somebody, the last thing I want to do is waste their time and money with a procedure that isn't going to help. But
I'm sorry.
No, that's it. So then once I get that paperwork, if they do in fact fit sort of in my wheelhouse, then I ask them these 9 questions in the same order, and I have a pretty clear idea based on what they tell me what the treatment is going to be.
Gotcha. So if you refer someone to a surgical, a surgeon, and they go through a surgery, is there any benefit in stem cells, exosomes, post-surgery?
Oh, you bet. I mean, that's sort of case by case. And then there's some people who, I'm sort of on the fence, and there's some where stem cell therapy might help them. I'm not really sure. Surgery, so there's variances within that. But yeah, sure. I mean, people who absolutely need surgery, and then we wait, probably 6 months to a year, and then consider whether or not, because maybe they won't even maybe the surgery will completely cure the problem. Hopefully it will.
Hopefully.
Mm-hmm.
You had a question.
No, I didn't. I'm just mind blown. There's like so much new, like this is crazy stuff. So it's awesome to know. I'm thinking about my questions.
Okay. Well, one of the things I want to talk about is the regulatory landscape for stem cells. And I kind of go back to, Bush and how this became so controversial. And, it seems like to a certain extent we've lost a step or two in the kind of innovation race for stem cells to other countries who don't have the regulatory landscape that we do. So how do you overcome that as a physician, and how, what does the next 5-10 years look like in regulatory environment, especially in the naturopathic side versus clinical application?
Well, there's sort of 2 things to talk about here. One, like when you use the word Bush, and you're sort of talking about like early on stem cell research. That was about embryonic stem cells. So embryonic stem cells are stem cells derived from an embryo, and an embryo it's important to note, is a ball of 8 cells. It's not a fetus, so it's nothing that looks like a baby. It's a ball of 8 cells. However, because it is an embryo, it can be considered a human life. And for that reason, it is very controversial, because in order to use those cells, you're potentially terminating a human life. Now, the cells that are, the embryonic cells that are used are from an in vitro fertilization bank that are going to be in a freezer till time immemorial and will never be used for any other reason. So, I mean, there's an ethical argument one way or the other. However, it doesn't really apply because actually embryonic stem cells are not the best stem cells to use therapeutically. They're actually too primitive. They're the ones, they're the ones when you hear about people going to, there was a very famous case about someone who went to Russia and had an epidural with embryonic stem cells and developed a tumor in his spinal canal.
Wow.
When you hear about people getting tumors from stem cell medicine, it's almost always embryonic stem cells because they're so primitive. They're way at the very top of the family tree. They're the most primitive type of stem cell. They can turn into anything. And they tend to turn into anything. What I use and what most people are using now, especially for the treatment of musculoskeletal pain, are autologous stem cells from a person's own body that are mesenchymal stem cells, which are way further down on the family tree. So they have much smaller distance to go to turn into a muscle cell or a ligament or any other type of
or a possible mutation like.
Yeah, there's a lot less chance of. I mean, I don't know that there's ever been a recorded case of an autologous where donor and recipient are the same person of there being a tumor from that. So we're sort of that controversy is, the ethical controversy doesn't exist. Now there's the controversy of what is and is not legal. And this is getting into the area of money.
That's usually how it works.
Right.
Follow the cash.
Right. So the big, what's been in the news in recent years is the use of stem cells from fat. Now, bone marrow stem cells is sort of off the chopping block for the time being because it has such a long history in cancer therapies. And when we use it in this regard, and using it for like arthritis, the knee or the low back or whatever, it's considered an off-label use. Okay. But it has such a long history in cancer therapies that there's really no way to argue that it's very much a part of medicine.
It's efficacious.
And it's used. I mean, it's just it's in medicine. I mean, it's just part of medicine. Whereas the use of stem cells from fat is a very new thing. And when you do a lipoaspiration, you take you just do like a miniature liposuction, take a very small amount of fat, then you put it through a process where you can isolate the cells from the fat tissue, the stem cells from the fat tissue. Now, the problem here is it's really sort of a new procedure. There's no precedent. It doesn't exist in any other area in medicine. And you get this very large volume of stem cells, and the big pharmaceutical industries have stem cell products in the pipeline that this is competing with.
Gotcha.
And it's bypassing all the steps that you have to go through to get an approved drug. So it's sort of like a cottage industry do-it-yourself that doesn't sit well with big pharma. So the FDA 2 years ago issued a position paper giving the industry 3 years to comply, saying we've determined that stem cells from fat tissue is a drug and a non-FDA approved drug, and we are giving the industry 3 years to comply. And that's what I'm doing. I don't like it, but I don't get to make the rules. Those guys get to make the rules. So in November 2020, I plan to completely discontinue the use of fat-derived stem cells.
Interesting. That's unfortunate.
That's the bad news. The good news is to take its place is the use of exosomes. So that leaves me with bone marrow stem cells. And in recent years, what I've started supplementing my stem cells with are two products. One is exosomes. So exosomes are placental stem cells. So it's a laboratory that takes placental stem cells, and they culture expand them. Now, normally it's against the law to culture expand stem cells for therapeutic use. But what they do is they culture expand the stem cells, then they take these stem cells and put them in a stressful culture medium, essentially trick them into thinking that their host is under duress. So they manufacture these vesicles filled with growth factors that are the very active ingredient of these stem cells, and they sort of prompt them to excrete them. Then they separate the stem cells from the exosomes. So now you no longer have a stem cell, you just have the active ingredient.
Interesting.
Right. And so what we do is we supplement your own bone marrow stem cells with these exosomes. Now, what makes somebody, if my 70-year-old patient from earlier today, what makes his 70-year-old stem cells 70-year-old stem cells is they lose the ability to manufacture these very vesicles filled with growth factors. So we supplement his bone marrow stem cells with the exosomes, and what we think is happening is we're effectively making his stem cells that of a younger person. And that's been my experience clinically.
Wow. Is there a way to validate that? Like we've talked a lot about like telomeres or telomeres. Is there any test that would show that, by supplementing with these exosomes that we are having some kind of impact on whether that's cellular aging or just the aging process in general?
Well, currently the best data that exists is on renal function and looking at people who have renal disease, administering intravenous stem cells and tracking their renal function.
Okay.
The laboratory that I use is Chimera Labs, and they're very active in researching this. It's for that type of thing, it's much easier to look at sort of systemic disease. I don't treat systemic disease. I just treat musculoskeletal pain. But that has been my experience just clinically. For years, I would use people's own stem cells only, and I did very well with younger people. But as people got older, it was more hit or miss because their stem cells are older. So it makes sense that I just didn't have as good an outcome. Sometimes it worked great, but it just more frequently, I would have non-responders. I would have a higher non-responder rate. Since I started using exosomes, and this is just based on my own personal experience and tracking people's outcomes, when I add the exosomes to their own stem cells, older people react like younger people do.
Wow. So this really opens up an opportunity for therapeutic value for a demographic that you didn't have, 5 years ago.
Yeah, and then also just as I prepare to lose fat-derived stem cells, I'm just going to, double or triple the amount of exosomes that I use, and hopefully that'll make up for what I lose by taking out the fat-derived stem cells. So the other product that we use is called Whartons Jelly, and Whartons Jelly is the insulation layer of the umbilical cord. It's a gelatinous substance that's made up of bioidentical human-derived hyaluronic acid. Now,
say that 10 times real fast.
Hyaluronic acid. It's not that.
The bioidentical.
Oh, that.
Yeah, the whole thing. So
I say it about 50 times a day, so I'm used to it. There are a lot of clinics that use umbilical cord stem cells. I do not, because the people who come to me want stem cells from their own body. They don't want stem cells that contain somebody else's DNA, which is understandable. As far as we know, using stem cells from an umbilical cord appears to be safe, but we don't know all the details, and some people just philosophically prefer not to, which is a reason not to do it.
Makes perfect sense.
It's a legitimate reason not to do it. But this is just the hyaluronic acid, the gelatinous substance. It is the ground substance of ligaments and intervertebral discs and joint surfaces. So we like to use it in addition to the people's own stem cells supplemented with exosomes as to sort of give people the building blocks they need to build up new either joint surfaces, intervertebral discs, or ligaments.
Wow. So that seems like something that would really work for degenerative things, like knees, elbows, a lot of like what I would consider athletic injuries from, repetitive stress.
Right. That's right. Yeah. I've found that combination. So currently we're doing bone marrow combined with fat, combined with exosomes, combined with Whartons Jelly. As we, in the next year, we'll phase out the fat-derived stem cells and just do bone marrow, Whartons Jelly, exosomes. And
you guys have kind of been the, shall we say, the proprietors of the full body. And let's talk a little bit about that. We might have to take a quick break. But
Sure. So over the years, I got more and more sort of farmers and ranchers and oil field workers and just these people who literally have arthritis throughout their entire bodies. So I got very used to doing these big treatments, and I would just sort of like affectionately refer to it as full body stem cell makeover. It was just sort of, I would say it kind of as a joke, but
But we would do, true, right?
We would do their entire spine and both shoulders and both hips and both knees. Well, then in 2016, early 2016, Dave Asprey became a patient, and sort of everything changed for me. And then suddenly I got all these biohackers interested in longevity, interested in attaining optimal health. You know, really people who want to live for a long time and who want to be, you know, experiencing optimal health right up to the bitter end.
Like they don't necessarily have something wrong with them or pain. Mm-hmm. They just want the longevity.
Mm-hmm. That's right.
Awesome.
So I was, I was on a kite surfing vacation and kind of reflecting on the last few years, trying to figure out what the next big thing would be. And the idea, I sort of looked back at my roots, which was what really set me on the path to alternative medicine, was rolfing. I had this knee pain that I couldn't really figure out, and I had 10 sessions of rolfing, or structural integration, done. And rolfing is this very systematic approach where you do this very deep tissue body work to the entire body in over 10 sessions. And I started thinking about it, and I started thinking about full body stem cell makeover. And I really realized that I was getting these people who were saying, well, can't you just treat my entire body in a single sitting for longevity purposes? And I thought, well, yeah, actually, I can. I've got great anesthesiologists, because we put everybody to sleep for these treatments. These are very painful. There's no reason to be awake for it. So we get people very comfortably to sleep. We take a large volume of stem cells, supplement with a large volume of exosomes, inject the entire spine from the base of the skull down to the tailbone, flip them over, both shoulders, both elbows, both wrists and thumbs, both hips, both knees, both ankles, and great toes. And then when I'm done, Amy Killen, who injected y'all's faces. And,
she's the reason I look like this.
Yeah. She does this. She does that. She does the skin of the face. She does the scalp to improve the health of the hair follicles, and she does the sexual organs for sexual optimization to improve microcirculation and elasticity of the genitals.
So here's one question I have to ask. It's a mechanism of action, right? So she's injecting my face with exosomes, and it is not a painless process.
Mm-hmm.
So why is the exosome different in that kind of pain response versus just PRP or versus stem cells?
Why is it so much more painful?
Yeah, why the hell does it hurt so much?
Because she's mean.
Oh. It was personal. Okay, I get it.
Normally, exosomes actually, when we're treating people here, we're normally treating people while they're asleep. And what I found is, since we added exosomes, when people wake up, they have much less pain.
Gotcha.
Oh, wow.
So I was just a schmuck for doing it awake. All right. And she's back there laughing.
A schmuck.
I know that you've got a patient. So first of all, I mean, we really appreciate this, and we've got a lot more to cover. Do we need to take a break right now, or
no? We can just jump in. I just briefly mentioned tithing program.
That's what I
sure.
wanted to get into.
Yeah.
So, on Life to the Max, one of our focuses is really on social responsibility,
Mm-hmm.
on people who are on the cutting edge of health and wellness. And you obviously represent the cutting edge, but there's also a social responsibility element to what you guys are doing here at the clinic. So I'd love to hear more about that.
Sure. So I'm sorry to say, about 3 years ago, I had a big health hiccup myself. I got a bacterial infection of my heart, which turned out to be from bad dental work. But anyway, it resulted in a stroke. So
wow.
I ended up, lost the ability to speak, lost the use of the right side of my body, and ended up in the hospital. And the surgeon came in and said, well, the good news is we figured out why you keep having strokes. The bad news is you have a bacterial infection of your heart, and you need open heart surgery. I had a aortic valve replacement. It was like a 7-hour cardiac bypass surgery.
How old are you?
I'm 51. Yeah.
Wow.
And I'm in perfect health. So
yeah.
it was one of these, it was from cavitations. It was from bad dental work.
Wow.
So anyway, the upside of that was I got to experience pain that ranked on a 10 out of 10. And it didn't feel like a gift at the time, but what I realized after is, as I was sort of recovering from that, it made me remember why I'm doing this. Because for a while there, it kind of became about me and not about actually relieving people from pain. And, some of the greatest advances in medicine won't do anybody any good if they can't afford it. Mm-hmm. So what we did is we instituted our tithing program, which is 1 day per month. We do treatments at no charge. And the way we do it is to enroll people into the program. First, they have to demonstrate that they are living beneath the poverty line. Mm-hmm. Once we've established that they are the medically underserved, then there's 2 pathways for enrollment in the program. One is for U.S. combat military veterans. If you've served this country in combat, you're good. Like, we will do a stem cell treatment at no charge. The other pathway for people who are not combat service veterans is we will do stem cell therapy at no charge in exchange for community service hours.
Wow.
So 60 hours of community service will purchase a stem cell treatment of the joints. 100 hours will purchase a stem cell treatment of the spine. 120 hours gets combo, some spine, some joints. We have instructions for this on the website, very clear instructions on how to enroll in the program.
We'll definitely put that in the show notes. And then you work with 3 charities, is that correct?
Right. So we decided to just go ahead because then, we didn't want to have to, I seat people at my church. So we just said it's these 3. It's and it's on the website. It's Habitat for Humanity, Boys and Girls Club of America, and the VA hospital. So one for vets, one for kids, one for homeless.
That's all you need.
Yeah. Cover it all. Yeah, it's amazing.
Yeah.
So how many patients are you seeing through this tithing program?
Well, it took a while to get it set up and going, and I think in 2 weeks we have our first cases.
Oh wow!
Yeah. So
congratulations!
We're really happy about it. Yeah.
That's fantastic.
Yeah.
So one of the things we like to ask really kind of in-depth questions here in Life to the Max podcast, because really this is about what is the future? How are we, people like you, people like us, people like Dr. Killen, who's laughing over there in the corner, probably at me, making an impact in the world. So you do such incredible work here, but how do you 10x this, right? What is the next level for you? If we could give you the magic wand and say, what's your one wish? How do you go out and do the work that you've been doing, but make it so much better? Or is there something else that you're passionate about that is beyond stem cells and exosomes?
Well, I think the whole concept of doing a tithing model based on in exchange for community service hours is something that I heard somebody else talk about. So if there's doctors listening to this, I think it's a great model. Have a look at our website.
I literally can geek out on the science for this forever, so I don't want to bore the audience, but I do want to kind of wrap up and talk a little bit more about, what does it take to be a patient here? How do people find you? And then, who's really the best candidate? When someone's watching this, they're at home like, well, I've got chronic pain, I'm thinking preventative. I'm thinking, well, I follow Dave Asprey or Ben Greenfield or some of the other people you've had in here. How do people reach out to you? And then, what's that kind of litmus test that someone should be looking at inside and saying, yeah, I want to reach out to these guys and this is something I should be interested in?
Sure. Well, there's 2 types of people that we see here. One is people who are suffering from chronic musculoskeletal pain, whether that's low back pain or neck pain. We treat a lot of intervertebral discs, which sets us apart from most places. But we also do plenty of hips and knees and shoulders and that sort of thing. And if it's pain that's been bugging you for over a year and you can't seem to get relief, have a look at, first and foremost, have a look at our website because we have a lot of information on there. I have a bunch of videos on there. Also, my Instagram page, my Facebook page, all of that. We have especially my YouTube page. My Docere Clinic's YouTube, we've got a mountain of information as well as something like 300 patient testimonials.
Oh, wow. And we'll make sure to put all of that in the show notes so you guys can get that, in the podcast.
But just doing a little bit of homework like that is going to help people to decide, self-select to determine whether or not they're actually a reasonably good candidate for treatment. And then beyond that, there's our anti-aging patients, which are people who come for longevity purposes, people who are interested in optimal health and want to, live life to the fullest for the longest. And that's where we develop full body stem cell makeover for, and that's where Amy and I work together to get stem cells from the place where they are hibernating and put them into all the musculoskeletal structures and the skin of the face and the scalp and the sexual organs to optimize those areas.
Wow. So you said about 80% of your patients come from out of Utah.
Yeah, somewhere between 80 and 90% come from out of state, and we get a lot of international. And largely that's from, being the stem cell doctor to Dave Asprey and Mark Hyman and Ben Greenfield and Vishen Lakhiani and all those guys.
And now Janna Breslin.
That's right.
And I guess not me. Stoked.
So we'll, I think, do you have any other questions?
Any question I was going to have, you answered along the way, so I was just absorbing it. It was amazing. Thank you for all the information that you have shared. Super fascinating stuff.
It's been a treat having you guys here today.
Thank you. Yeah, I think everyone will get a lot out of it as well. So.
Yeah. Thank you so much, Dr. Adelson. We will have all the information for his clinic here in Park City, Utah, where we've spent the day being poked, prodded. I don't know what else. It's,
all of it. Yeah.
I can't feel my face. I can't feel my nether regions. We're going to talk about the P shot in the next podcast. But you guys have such an amazing clinic here, and we want to thank you for all the great work that you're doing, not just in health and wellness, but in kind of your community outreach and your tithing program. So excited to share this with our audience, and can't wait to. Thank you so much.
Thank you.
All right.